So we get the question commonly, and it's understandable, of why would I attend your dental assistant program when I could be on the job trained? And it's a completely valid question, and not every person has the ability or the time to attend an education program, whether it's our program of 13 weeks or a 10 or 12-month program. So your only option is to take an office that can give you that ability of on the job train. So, after 22 years as being a dental assistant, what I would say from my experience, and I know John as well from his experience after 31 years, is that the majority of offices do not have a true plan of on the job training. Sorry to the dental offices that are listening, but also maybe to the dental offices that are listening, just be real with yourself as well, and maybe hire a dental consultant that can help you come up with an actual true plan of training. The majority of our on the job training is that a new hire is assigned to a dental assistant that is at that practice with more experience than them. That could be 2 months, it could be 2 years, it could be 10 years or 15 or 20 years. But with that said, the person that is training you as an on the job trained dental assistant also could have been on the job trained, also meaning that sometimes that infection control standards get lost in the shuffle because things are not being done correctly or efficiently. Also, the fact that when you're on the job trained, that on the job training is only based on what that doctor is teaching you. So, what if that doctor retires and you need to take another position, or there's not a growth opportunity for you at that office, and you know that your ability is something a little bit more, that you're just looking for another opportunity out there, and now you go to another practice and you're like, oh my gosh, I didn't know that I was doing this wrong all these years, or this is the way Dr. Smith did it, and now this is the way the new doctor is doing, which is always going to be a change no matter if you go to an education program or if you're on the job train. But a lot of us, yet again, that if you hire Sarah and there is a lead dental assistant, Emily, that's at that practice, then that Sarah is typically assigned to Emily. And Emily, hi, we hired Sarah. She's the new dental assistant. And off you go. That's the plan. That basically what Emily can teach you today, that hopefully you can remember tomorrow. I like to refer to it as learning on the job, not so much training on the job. So just keep that in mind based on your needs as an individual person. So, an education always enhances understanding, and you're always going to have a bigger, broader explanation of content. So, that is always my valid explanation of why you should attend an education program, or if you can be an on the job trained. Very much a large amount of kudos to you on the job trained dental offices that have a great training plan in place. That's wonderful.